ureaplasma and fertility from both a Western perspective and traditional Chinese medicine perspective. So, Western medicine says ureaplasma is a common bacteria, and this can cause low grade inflammation in the uterus or tubes. And we say that this could sometimes quietly block fertility. But here's the thing, there are women that say after trying 2 weeks of antibiotics, they finally get pregnant. So we don't know. Is that coincidence? There's been a good number of reports. But there's also research that shows there's resistant bacterial strains. So it could be clearing inflammation that's silently interfering. But then if it's resistant, you got to look at other ways to treat. And with traditional Chinese medicine, we look at this like a damp heat and we say in the lower jiao. So it's down below. And how does that show up is with chronic discharge, pelvic fullness, a little bit achy discomfort, low back pain, low back aching, with all the other symptoms too. And what we do is we treat that with herbs. I'm not going to give you the formulas because they're really intense, and you would have to truly have that condition or that pattern diagnosis in Chinese medicine. Otherwise, it could really mess up your gut. But the focus would be on clearing dampness, draining that out, clearing heat, moving oxygen and circulation. And the integrative support, whether you do, whether somebody does antibiotics or not, is to focus on healing the gut, healing the vaginal microbiome with probiotics and using anti-inflammatory foods. And then with traditional Chinese medicine, focus on nourishing fluids and blood, especially post-treatment if you do decide to do the route of antibiotics. But the most important thing is to check in with your doctor. Don't ignore these signs. Your body's talking to you for a reason. And it's really nice when we get these clues because then we can work on things. So ask your provider to test and your choice, but I'd still look at healing with a root cause approach, or you can go the route of trying antibiotics, but definitely talk to your Western doctor. I am not that. I hope this